Medical acupuncture, or as it's sometimes known, trigger point dry needling or trigger point acupuncture, is a form of treatment using acupuncture needles to release tight or taut bands and knots within muscles. Sometimes these knots are called trigger points, and they are responsible either for localised pain in the area or quite often referred pain away from that area. There is certainly a correlation and overlap, so many of the trigger points and knots that we target with medical acupuncture and dry needling will correlate to traditional Chinese acupuncture points. The difference, I would say, is the number of needles in the application. So with traditional Chinese acupuncture, very often the acupuncturist will be putting the needles just under the surface of the skin, because in Chinese philosophy that's where the qi flows, just under the skin. And it's not uncommon for them to use quite a few needles, 20, 30 needles in a session. With the medical acupuncture and the trigger point dry needling, fewer needles, probably 5, maybe 10 needles at most, and those needles will be going a little bit deeper though. We're purposely targeting those deep knots within the muscle. So not just worried about are we on the point, are we on the right depth as well? And that's what we're after, getting that little response from that knot in the muscle. We often get patients coming to us who have already had traditional Chinese acupuncture at other places, and when they experience the sort of acupuncture, the medical acupuncture that we do, we'll say that it does feel quite different. And the reason for that is that with the medical acupuncture, we're trying to purposely target those knots, those trigger points in the muscle. And if you do that precisely and do that accurately, you'll get a little, we call it the twitch response, which basically means like a mini spasm within the muscle. Now, it shouldn't really be painful as such, but it is a definite thing, and it will feel like anything from like an ache in the muscle to like I say, like a spasm. But it should be quite gratifying. It should feel like, yeah, that needle's got right to the source of the pain. That's right on the spot where I'm getting my pain from. So whilst it's on the, you might describe it as on the borderline between kind of comfort and discomfort, but it's a good type of pain if it is the case. And certainly if you're getting any sort of sharp, nasty pains, then it means it's not being done correctly, or they'll need to do it in a different way. Yes, when performed with the correct technique, it's a very safe technique. Unlike a syringe needle that you get with injections, the needles we use with acupuncture are very, very thin. So, and also they don't contain any liquid, I'm not injecting anything, so the risk of infection is pretty low. The more common examples of complication, let's say relatively minor, would be bruising. So probably 1 in every 20 needles you might get a superficial bruise on the skin, which could last for a few days, but as I said, it's usually no more than that. The most serious risk, which people need to be aware of, would be when doing acupuncture around the chest or around the chest wall, and that includes even above the collarbone as well. The reason for that is the lung tissue. So the lungs are just underneath the rib cage and also just above the collarbone as well. So if it's not done correctly, yes, there is a risk that you could hit a lung, and if worst case scenario, that would mean a collapsed lung and that would require reinflation in the hospital. So what we have to do with that is use the correct technique. We use what's called a muscle pickup technique, where we grab the muscle, make sure it's well away from the lung tissue, in the case of this area here, and that way then you're making sure the needle goes nowhere near the lung. If it's around the chest wall at the back, let's say over the rib cage, then again you have to insert the needles in a particular way so that you're not running the risk of inserting those needles in between the ribs, and that which could risk obviously hitting the lung. Medical acupuncture, trigger point dry needling, in my opinion, is a really, really effective, useful technique. Works really well for certain types of back pain, other conditions such as tension headaches and many sports injuries, tennis elbow, golfer's elbow. If you add acupuncture into the mix, again, really good outcomes. Certainly, when I've tried it on patients myself, got really good results. When I've received it as a patient myself, great results for myself. I often say to people, if there was only one way that I could treat somebody, whether that be massage, manipulation, electrotherapy, if I had to just choose one of those and one technique to use forevermore, then it would be acupuncture, or medical acupuncture to be more precise. Thank you for watching this video all the way through.
For effective treatment and advice for muscle and joint problems throughout the body at either of our clinics in Chigwell or Woodford, call us at Spine Plus to book an appointment on 0208 501 0937. You may like to know that we've made several other videos with information and self-help tips on specific problems, everything from tension headaches to heel pain. Some of our suggested videos are shown below, or you can search our playlist to discover more. We'd also be really grateful if you could like and share any videos you watch, and please subscribe to our channel by clicking on the subscribe button to be kept informed of our latest information. For more information on our clinics, click Find Out More to be directed to our website.